On March 24, 2020, the Centers for Disease Control and Prevention, CDC, of the United States, indicated the WHO had provided two codes for COVID-19, U07.1 when confirmed by laboratory testing and U07.2 for clinically or epidemiological diagnosis where laboratory confirmation is inconclusive or not available. The CDC noted that because laboratory test results are not typically reported on death certificates in the U.S., the National Center for Health Statistics, NCHS, is not planning to implement U07.2 for mortality statistics and that U07.1 would be used if the death certificate reports terms such as probable COVID-19 or likely COVID-19. The CDC also noted it is not likely that NCHS will follow up on these cases, and while the underlying cause depends upon what and where conditions are reported on the death certificate, the rules for coding and selection of the cause of death are expected to result in COVID-19 being the underlying cause more often than not. On April 16, 2020, the WHO, in its formal publication of the two codes, U07.1 and U07.2, recognized that in many countries detail as to the laboratory confirmation will not be reported, and recommended, for mortality purposes only, to code COVID-19 provisionally to code U07.1 unless it is stated as probable or suspected. It was also noted that the WHO does not distinguish between infection by SARS-CoV-2 and COVID-19.